Joe Biden wants a national lockdown. But do the lockdowns even work? Our guest, Phil Magness, a senior research fellow at the American Institute for Economic Research, author of numerous works on economic history, taxation, economic inequality, the history of slavery, and education policy in the United States, has written a piece that caught our attention entitled 12 Times the Lockdowners Were Wrong. And in case you wonder what I talk to the guests about before we start the interview, I often ask people what they had for breakfast. I find it very interesting to see how people started their day. And Philip's answer was that he had French toast, and he seemed a little bit embarrassed because that was somewhat indulgent. But he said he was off today, so that's why he did it. Did I get that right?
That is correct.
It still feels really indulgent on a Wednesday, whether you're off or not. I have to tell you, I'm kind of jealous. Ramon and I are both on diets, so we're really just – I haven't eaten for 20 hours right now. So anyway, 12 times the lockdowners were wrong. How did you go about this research, and did you go into it with the expectation that the lockdowns don't work? And how do you determine whether they worked or not?
Yeah, so fascinating thing about this whole ordeal we've had for the last, I guess we're going on 10 months now, fighting the coronavirus pandemic with a very blunt instrument of lockdown strategies, is it's a topic I started to research back in the spring, as did most people when this burst onto the scene. And one of the first things that I noticed, and going back to the old epidemiology research, really anything that had been written about pandemics prior to about February or March 2020 took a tone that was actually very skeptical of whether these lockdown instruments worked. There was a report that came out of Johns Hopkins University, one of the top medical departments in the world, in September 2019, and they basically said, if there's a pandemic, here are mitigation measures we use, but lockdowns have a poor performance record. They haven't worked at times we've tried them in the past. This is a really bad instrument that has a lot of costs associated with it. Also notice that if you go to January, as recent as January 2020, just a year ago now, Anthony Fauci gave an interview with CNN right after the Wuhan region in China enacted its first lockdowns, and he basically said, this is a policy that can never work in the United States. I can't ever imagine shutting down New York or Los Angeles. And he says that the reason that he couldn't imagine this is because when you look historically, when you shut things down, it doesn't have a major effect on the pandemic. What happened 2 months later, Anthony Fauci was leading the charge to lock down New York, Los Angeles, and the rest of the United States. So just seeing this track record and how it's performed and played out over the last 9 months has been eye-opening in what it tells us about the expertise that we put our trust in with our government.
You know, what's so frustrating about that, do you have a sense of why Fauci gravitated toward lockdowns and then embraced them?
Well, the main thing that we hear from the narrative coming out of Washington was right after that report was published by Imperial College London. This was the epidemiologist Neil Ferguson. That happened around, I think it was March 16th of last year. That really kind of shook up the political scene in both the United States and the United Kingdom by giving them this projection that if we did not lock down, 2.2 million Americans would die. It's like a doomsday scenario. And that really just kind of drove everyone that had thus far been fairly reasonable on the mitigation efforts of the pandemic into a frenzied lockdown mode, and they rushed through this ill-conceived policy in just a matter of days, and next thing you know, we were operating under 2 weeks to flatten the curve, which extended to 2 months, which is now extended to almost a year.
So they don't work in terms of stopping the spread of this this relatively contagious virus. But let's talk about the economic impact, because that's why it's not who really cares if they work or not? Let's try everything. Well, first you start with the loss of freedom, but secondly, as an economist, what kind of economic damage did we do?
there is massive, almost historically unprecedented damage and spillover effects of locking down. There was a study that just came out last week that estimated the toll of shutting down the economy, the toll of unemployment from the year 2020. If they spread it out over the next 15 years, they are estimating almost 1 million excess deaths will occur from poverty and unemployment-related causes. We also have clear evidence from past recessions and economic downturns. Whenever the economy goes into the tank, substance abuse goes on the rise. Suicides start to go up. And the early data we're getting out of the CDC right now shows an unprecedented spike in opioid abuse deaths that happened coincidentally right in March of 2020 and played out at least through the summer, which is the most recent data that we have. So the economic impacts of this are not only pronounced in the immediate sense, and the fact that we had a huge unemployment crisis over the summer take place. These are things that are going to be with us for years, maybe even decades to come.
Yes, and I worry about the trend, the precedent that we've set, that the folks who become fearful want the government to give them a sense of security. It reminds me of the old, I think it was Ben Franklin line, who said those who seek, what was it? Those who seek security, those who seek safety and security from the government, or freedom, and will get neither. What was the line? I just lost it just as I started to say it. But the point was, you're sacrificing your freedom in exchange for a sense of security. And your point is, it's a false sense. So for all the negative effects, it also doesn't stop the spread, which is the part that's really irritating.
It's infuriating to see this. And you know, the classic line is the definition of insanity is doing the same thing over and over again and expecting a different result. Well, what have we been doing for the last year? It's lockdown after lockdown after lockdown, not just in the United States, but we saw this in Europe and the UK, other parts of the world. They keep using the same policy instrument over and over again, and it doesn't do what it promises. It doesn't defeat the virus. It doesn't flatten the curve. It has made basically no noticeable dent on the pandemic's course itself compared to other locations that did not lock down, other states that did not lock down. So you start to have to ask the question of yourself, like, why are we indulging this horrendously costly policy response to no effect? And not only doing it just once, we've done it now 3 or 4 times in repetition in some states and countries. And it seems like there's no end in sight.
You point out in your 12 times the lockdowners were wrong. As number 5, Neil Ferguson predicted a best-case U.S. scenario of 1.1 million deaths. Why do you think the number was so high?
Well, Neil Ferguson, if you look at this guy, he's an epidemiologist in the UK who has been predicting pandemics for decades. This goes all the way back to the mad cow disease outbreaks that happened in the late 1990s and early 2000s. And I actually studied some of his earlier work. He has a track record that every single time a pandemic comes along, he publishes these outrageous predictions of hundreds of thousands or millions of people are going to die, and they never seem to come true. So like in mad cow disease, he was projecting something like 100,000 deaths in the UK, and it ended up being less than 200. Then he predicted a mad sheep disease pandemic that was going to kill another 100,000 people and ended up killing nobody. When the bird flu and the swine flu epidemics were on the horizon, he was predicting these massive models that showed millions upon millions of deaths and cases worldwide, and it really doesn't ever pan out. So you've got a guy that has a track record of failure after failure after failure in making alarmist claims about pandemics. He comes along with COVID, and what does he do? The exact same thing that he has in previous pandemics, although COVID happens to be a more serious and more dangerous disease than some of the previous misfires. But he still does the same thing. He exaggerates his model. He speaks in alarmist tones. He tells this to reporters at the New York Times, and they take it and run with it because they support the policy.
Because it makes for a great headline. Yellow
That's
journalism
exactly.
all over again. We just call it clickbait. Item number 7 on your list of 12 times the lockdowners got it wrong. Scientists suggested that ocean spray spreads COVID. That was as late as April 2nd. They were saying such nonsense. Flesh that one out.
Wow, that was one of the more odd stories. Some of your listeners may remember back in the spring, the state of California was arresting people for walking alone on the beach. And I think the worst example, there was a guy that was out paddleboarding on his own in the middle of the ocean in Malibu, and they sent out police boats and arrested the guy and fined him. And people were asking, why is this the case? Well, there had been a claim published out of one of the epidemiology departments in California, put forth this crazy theory that stormwater runoff washed COVID out of the air and into the streets and into the gutters, and it flowed out into the ocean, and then ocean waves would stir it up as like a spray and spread it across the beach, and that was how COVID transmitted. There's a major story on this in the LA Times and several of the other papers out there. And no one really ever investigated whether this was true. It ended up being kind of like a crackpot theory. But, within a couple days of this claim being made, police departments are out arresting people on the beach because they've deluded themselves into thinking that ocean spray is spreading COVID in the air.
My goodness. One of your points is that New Zealand and Australia have declared themselves COVID-free. They've been very successful in combating COVID, have New Zealand and Australia, but that the reason is not because of the lockdown. The reason is their unique geography and how they've walled themselves in. Can you speak to that?
That's absolutely the case. So prior to COVID coming along, this was a well-known feature of the epidemiology literature that it is possible to, at least for the short term, contain pandemics if you have a geographically advantageous place, namely an island that has few entry and exit points. If every visitor to that island comes through one or two airports, it's relatively easy to seal off the borders if you do it early and you do it before the disease has really taken root. New Zealand and Australia were somewhat fortunate in this respect in that they did not get an early undetected arrival of COVID. We know this disease popped up in Europe probably as early as December of last year. It probably arrived in the United States around January of last year. Australia and New Zealand were later on that arrival date, and they didn't have nearly as much undetected spread. So when they shut down their borders, it basically worked as at least a short-term containment effort. The problem is you cannot replicate that for most countries in the world. I'll give you an example. There are single airports in the United States, like New York JFK or London Heathrow in the UK, that have more traffic going through that one airport in a given year than the entire nation of Australia does. So it's really not a valid comparison to say that we could copy what Australia and New Zealand did. The other trick to this is even though a border closure does keep viruses out in the short term, it's a very fragile solution. It can't work indefinitely because, it's simple matters of human error mean that a case slips through undetected, or maybe a border agent wasn't enforcing the quarantine the right way on that day, or maybe there's an undetected arrival that comes from someone that didn't really know that they had it. And this is what we've seen as a recurring pattern in both Australia and New Zealand over the last year, is even though they successfully kind of clamped down on the pandemic and kept cases low, they keep coming up with these political declarations. So Jacinda Ardern, the Prime Minister of New Zealand over the summer, had this even like a ceremony where she declared the country had 100 days without COVID, and then 2 days later, on day 102, an undetected case had slipped through the border wall, and suddenly they were back in lockdown again. Same thing has happened in Australia on numerous cases where they've declared themselves as being victorious over COVID, and then a couple of days later, an undetected case comes through it. They even shut down an entire province there because there was a misreported case that was connected to a pizza delivery driver, and then they went back and investigated and found that it was an error. But what this keeps showing is that even though they're claiming victory over COVID time and time again, the fragility of their strategy is such that victory is not a permanent solution. It's something that's really difficult to maintain. So not only does it not apply to the rest of the world because of geography, it's something that internally in New Zealand and Australia has caused both of their governments a lot of embarrassment by proclaiming victory too early.
You note that Anthony Fauci pointed to New York, to the line in the Wall Street Journal. He said of New York, they did a really good job of keeping things down, and still their level is low compared to the rest of the country. And you say New York did not do a good job with their policies, and they probably made it worse. Can you speak to that?
Yeah. So New York State, if you look at the number of COVID deaths per capita, they are not only one of the worst locations in the United States, they're one of the worst locations in the entire world. It's New York and New Jersey are kind of neck and neck in the number of deaths per capita. And this comes out of just completely bungling and botching the COVID response from the outset in the spring. The most egregious example of this was the now infamous order from Governor Cuomo of New York that several other states around there also copied that said that nursing homes have to readmit COVID-positive patients that basically come to their doors. And the idea behind this order was that they thought that the hospital system was going to be overwhelmed, so you build slack capacity by allowing elderly patients to transfer back to the nursing home. Well, it turns out that the hospital overwhelming really never occurred the way that they predicted, but what we did see was that thousands of COVID-positive patients were transferred into the nursing homes, and they ended up being carriers into the nursing home facilities, and suddenly the next thing you know, COVID has spread to the entire facility, one of the most vulnerable segments of our population, the elderly. And shocking, it has a massive catastrophic death rate associated with it. So the latest statistics nationwide say about 40% of all COVID deaths in the United States have come from nursing homes alone. This is a segment of the population. It's less than 1% of the population accounts for 40% of COVID deaths. And New York is one of the worst areas for that. It's basically ground zero for botching the nursing home policy. So knowing that, it just astounds me that Anthony Fauci at any time could look back at New York and say, wait a minute, they did it right. And he not only did this over the summer when they were coming out of the first wave and things were finally decreasing in the number of cases and the number of deaths, he repeated himself just last month in December when he was asked this question again. He says, well, who did it right? And he answers, New York State did it right. Well, if we look at our stats from New York State in the fall, what happened? They had a second wave again, and that second wave was more severe than other states with similar large populations. So if you compare New York and Florida side by side, Florida is open, New York is not. New York has a higher death rate in the fall than Florida does.
Phillip, thank you for being our guest. I don't know if you're smart or not, but you sound smart. And you know what? That counts for a lot. You come back and talk to us anytime, my man. Thanks for this good research.
I appreciate it.